everyone in Facebook land. I'm Dr. Icy. I'm so glad to be here this afternoon to talk about heart disease as it relates to the coronavirus. As we know, the coronavirus is a huge pandemic and many of us are extremely worried, scared, and being on a huge alert because there's still so many unanswered questions. However, hopefully in this short segment, we're able to reduce fears, to answer questions, to share good information, to correct misinformation. So I'd love if each one of you could send me questions, comments. I'd love to hear from you. But first, let me thank our organizer, Ms. Rosalind Daniels, CEO and Director for Black Health Matters. Thank you so much, Rosalind, for having the foresight to put on a program like this at this much needed time where we want to hear information. This, along with many of the wonderful other programs that you're doing, will hopefully enlighten our followers here in Facebook land. So thank you very much. I'd also like to thank the Association of Black Cardiologists. As you know, I was past president, and I would like to congratulate the new leadership. Currently, the new president is Dr. Michelle Albert. The new chairman of the board is Dr. Elizabeth O'Feely. And of course, where would we be without our CEO, Cassandra McCullough? So thank you so much, ABC, for support and for the statements that you have put out there. I will be providing a number of references and resources. And of course, one of the places that you can go to is the Association of Black Cardiologists website, www.abcardio.org. For this segment, I have also done research and looked at materials and records from the CDC, World Health Organization, and the American Heart Association. And please feel free to go to some of these websites to look up and confirm details if you have questions. So thank you very much. So currently, as you know, this world pandemic is very scary. We're clearly almost to 1 million people with COVID who have been diagnosed with COVID worldwide. I believe the numbers are more like 910,352. But as the numbers continue to go up and we don't see a peak, this number obviously is expected to go up. The current numbers that I'm quoting, you can find on Coronavirus Tracker. You can go to MSN News and put in the search engine Coronavirus Tracker, and you're able to see all of these numbers that tell you about total numbers in the United States, as well as your state, your county, and of course the world. Now, in the United States, from the last update from the Coronavirus Tracker, it's almost 200,000 in the United States. And of course, here where I live in New York State, but especially New York City, which has been described as the epicenter, we have close to 90,000 individuals who have, the coronavirus. Unfortunately, New Jersey is coming along as well with numbers now close to 23,000. So what do we know about this virus? It's easy to be panicked, but when you look at TV, et cetera, but we know that 80% of people with the virus will have mild symptoms and recover. We have about 20% who will be serious, who are going to end up in the hospitals, and another smaller percentage of that 20% will end up in the ICU and on ventilators. Now, as a cardiologist, I'm seeing a lot of these patients who may have issues either related to the heart or having issues that develop with the heart after having coronavirus. So just a few facts. We know that those who are more likely to have serious outcomes from coronavirus, they have underlying conditions. So what are some of those underlying conditions? Well, we know that diabetes has been linked with some of these patients who are likely to have this bad outcome. In fact, new data suggested that of the people who were analyzed, 10% of the patients who were admitted had diabetes. 9.2% had chronic lung disease, and 9% had cardiovascular disease. So out of the risk factors for heart disease and for other chronic conditions, we know that patients with diabetes can be very serious. Now, if you manage your diabetes, if you're taking your medications, if you're already on medications, if you're eating right, hydrating, and doing all those good things that we keep on telling you about managing diabetes, or you keep on hearing from your providers, then you should be fine. It does not mean that everybody with diabetes will develop coronavirus. It just means that if you have diabetes and if you're more likely to have uncontrolled diabetes, that you may be someone who could develop the coronavirus. Some of the other chronic or underlying conditions may be lung disease. So people with, emphysema, COPD, asthma, interstitial lung disease. These, of course, could be underlying conditions that can predispose you to having the coronavirus. Obviously, if you have any type of autoimmune disease, so people who have things like lupus, arthritis, etc., some of these are the chronic underlying disease. But do not be fooled into thinking that only people with chronic underlying disease can get the virus. Some time ago, there were some misconceptions that young people cannot get the virus, but in some states, you have upwards of 30 to 40% of people between the ages of 18 to 44 who may get the virus. I'm receiving a call right now from the producer, Rosalind Daniels, so let's take that call. Roz?
Hey, we don't have a transmission.
Okay. So Rosalind is saying, can you guys hear me? Shoot me a message if you can hear it, if you can hear me. Okay. Rosalind, I think that people are sending messages, so I think they are getting, they are hearing. Okay, so we will continue. Okay, now many people are actually recovering from the coronavirus. So, you're hearing about some of the cases, and there's, of course, a high mortality rate, and we should definitely not take this lightly at all. But many people have mild cases, and if you have mild cases, you can actually recover at home. If you are exposed to the virus, the symptoms may appear 2 to 14 days after exposure. What are the symptoms? Well, symptoms may vary in different people, but you can have a loss of taste or a metallic taste. You can have loss of appetite. You can have aches and pains. You can have GI disturbances. Some people have talked about GI disturbances. You can have cough. But the symptoms that should bring you in or should alert you are if you start to develop shortness of breath, chest pain, and of course, if you have a fever, you should be highly alerted that you may have the coronavirus. If you're having chest pain or shortness of breath, those are definitely symptoms that you should come in for. So what happens is when you come into the hospital system, they're going to be doing a number of different testing. And one of the things that they test is to see if you're having a heart condition. Okay, so you may present with chest pain. They will check to see if you're having troponins. They will do an EKG. Unfortunately, those who have been shown to have a heart condition or elevated enzymes from their heart, those are some of the ones who are sicker and may progress to being intubated or being on a ventilator. So again, if you have an underlying condition related to the heart, that may be a risk factor, but please be aware that you may not necessarily have a heart condition or a chronic condition in order to develop, more significant symptoms related to the virus. Currently, what are some of the things that are being done? So I just want to, there's only one drug that was recently approved by the FDA, and that happened earlier in the week. But even that drug for the virus has potential side effects and should only be prescribed by a physician. And please do not take these drugs from another person. So this, you may have heard of this drug. It's called hydroxychloroquine. The name is Plaquenil. And that in combination with a Z-Pak has been approved now prescribed by a doctor for outpatient treatment. However, this drug may have some side effects. There are side effects with the drugs that could be related to the liver, to the eyes. You can develop eye issues, but you can also develop a heart condition such as an arrhythmia, an irregular heartbeat. And that itself can be life-threatening. Currently at my medical center, when that drug is prescribed, then it's only prescribed to people who are diagnosed with the virus and have symptoms and can be managed as outpatient. But if that drug is prescribed, then you will get a monitor. It should be prescribed with a monitor to ensure that you are not having any arrhythmias. I will read you some of the other drugs or other treatments that are currently available in the hospital setting. So most of the treatment is within the hospital setting and it's still under investigations. So I'm just reading this from a new download from the World Health Organization. There are a variety of therapeutic areas being evaluated. Of course, the antiretroviral drugs like remdesivir that might treat the specific virus as well as host targets. Now, we also have drugs that are called interleukin-6 receptor inhibitors that may be helpful in reducing lung inflammation and improving lung function. Also, there is convalescent plasma and hyperimmune globulin. These are antibody-rich blood products that are taken from blood of people who have already recovered from the virus. So people in the ICU who are not doing very well, some of the therapies they're getting would include plasma or antibodies from people who have already recovered and actually have these plasma antibodies in their blood. And this has been shown to lengthen or to reduce the length or lessen the severity of the illness for patients. So now let's talk about some myths. And I was actually looking on the World Health Organization website earlier, and you guys are welcome to go and look as well. And on the site, there is a segment that's called Mythbusters, okay? So before taking questions, let's talk about some of these myths, okay? So no, Black people are not immune to the virus. If you're Black, you can get it. In fact, because many Black patients have underlying conditions such as hypertension, diabetes, and other chronic lung conditions, they can in fact, develop the virus and then have poor outcomes. So color, race, or creed does not protect you from the virus. Another myth is that hot temperatures or a warm country or something warm will reduce or not allow the virus to spread. That's incorrect. You can look at World Health Organization. There are patients with viruses in warm countries, and no, if you turn up the heat in your office or in your home significantly, no, that does not reduce the virus. Questions about taking a hot, warm bath. It's not the heat of the bath, but the fact that things are being washed away is what's protecting you from the virus, so not the heat. Another myth that has come up is whether garlic protects you from the virus. And no, garlic does not protect you from the virus. There's no research saying that garlic can protect you from the virus, but what that goes along with is that many people can take different supplements, et cetera, to boost their immune system. So if you are, taking supplements or doing different things to boost your immune system, it can help your immune system, but not specifically get rid of the virus. So what are some of the other myths that are out there that has obviously been an issue? The question is, if you're young, that you cannot get the virus. Again, that's not correct. Unfortunately, we've seen a number of young individuals who may have, gotten the virus and they may have had some underlying condition, but there are some cases where there's no underlying condition. So you are not necessarily protected because you're young. Everyone should assume at this point that someone else may have it and take the necessary precautions, which, as we know, 6 feet apart, social distancing, and of course, general hygiene, hand washing, making sure that surfaces are clean, surfaces are wiped down, etc. So how long does the virus last in certain surfaces? And there was this is a question that's coming in right now. So I can look at that. And I actually have that data that was presented by Dr. Fauci a couple of days ago. So let me just give that to you. And it has not been updated. It's still the same. So the virus we know lasts in the air for about 3 hours. Okay, you may have heard of the choir. There was a choir that met with 60 individuals. They were practicing social distancing, etc. But despite that, 45 people came down with the virus. So what was thought about that is, even though they were practicing social distancing, when you are singing, there's sort of a forceful exhalation. So they're actual particles that could be disseminated, and in this case be aerosolized. So that's thought to be one of the reasons why so many people from the choir came down with the virus. But nevertheless, the virus is stable for 3 hours in the air, 4 hours on copper surfaces, 24 hours on cardboard, 2 to 3 days on plastic and stainless steel. So it can persist. It's very viable. But again, if you practice safe, clean, and well done hygiene, then it should be fine. So a question came in about wearing gloves. Okay, so the other day, there was an article that was actually written about gloves. Okay, so what's the situation with gloves? So the thing is, if you're wearing gloves, then you still have to practice safe management and safe hygiene. If something gets onto the gloves and then you take the gloves off, but you're taking off the gloves where you can touch what's on the outside of the gloves, or if those gloves are used to touch, different things that may have been contaminated, then you will contaminate everything. So there are 2 ways you could do that. You can either double glove when you're in areas that you think may have, high particle counts, etc. And then when you get from that high particle count, you could peel off those gloves with making sure you're not touching the tips or the palms of the gloves. And then you could use the other set of gloves to drive home, but you should still wipe down, still practice, good hygiene, still use hand wipes. And the reason why that article was written that said that gloves may not be that helpful is that people get a false sense of confidence when they're wearing the gloves. And so they may end up doing things that they ordinarily wouldn't do with their hands, which can also put you at risk. Now, there's a question about the mask. And welcome to everyone who's joining. Thank you all for joining. It's so great seeing you all on Facebook Live today. So it's just wonderful seeing you. I see my friends and colleagues, some Jack and Jill of America Incorporated, friends and colleagues from other Divine Nine organizations, friends and colleagues from the Links Incorporated, friends and colleagues from Alpha Kappa Alpha Sorority Incorporated, friends and colleagues from Kappa Alpha Psi Incorporated, friends and colleagues from the Montserrat Group Incorporated, just friends and colleagues from everywhere. So welcome, so glad to have you here and glad to take your questions. So before I go on to other questions, let me answer this question about the masks, okay? So right now the CDC is considering whether everyone should wear masks. My recommendation is just assume at this point that everyone is potentially infected. Okay, so as a healthcare provider, I'm wearing a mask with my patients, but for those who definitely have an underlying condition or who may be susceptible, they should wear a mask. If you're going to be going into a high, crowded area, then you should wear a mask. If you don't have a mask, other types of covers could be used, like you can use a bandana or a scarf. So it's not going to necessarily prevent everything, but if there are droplets or heavy particles in the air, then this can actually reduce the virus from getting in. So that's helpful. But again, if you have material on the outside of your scalp and you touch it with your hands, then you could carry the infection. So again, you're going to remove the mask as if the front is contaminated. Always assume that something is contaminated because you never know. So that's the answer to the mask. As of right now, they're not recommending that everyone wear the mask. But as I said, if you are one, susceptible or high risk yourself, or if you're going into a crowded area, and clearly a lot of the health providers on the line, they're wearing, personal protective equipment, which includes masks, gloves, and covers to contain themselves. Okay, let's see if we can look through some more questions. This is coming from, and I'm squinting, I'm sorry guys, I probably need my glasses, but okay, let's see. Okay, so this question is coming from Colin Riley, and he says, is there any sense whether or not those who recovered have developed immunity in corona? And yes, so as of right now, what we know is that people who have recovered, they have antibodies in their blood, okay? And in fact, what we're doing right now is in the hospital settings, some of these, individuals who are giving their blood, it's called plasma that we take, and that's being given to some of the sickest people. And because of that, that they've already had the antibodies is protected. So I don't know if a new strain can come, just like with the flu, but if a new strain comes, then that's something that we would obviously have to be concerned about. Okay, hello, Leslie. Okay, let's see, here's another question. For CNN, changing recommendation about wearing masks, correct. So that's coming in from the Solons. And again, as of right now, this morning they were considering, so the CDC is considering. The problem with everyone wearing masks, Joe, is that number one, for the people who definitely need it, who are otherwise compromised, by health or immunocompromised or have health conditions, or the healthcare providers, currently there's just not enough protective equipment, personal protective equipment, that everyone should get a mask. So the typical mask, like the N95 respirators, should be reserved for those settings as I talked about. But I think, again, if there are if you do not have a mask, and you can wear other protective gear, especially if you think there's high risk, then certainly that should happen. So there's a question from Gregory Georges that says, is it airborne? You may have already answered this one. So is it airborne? We know that it's aerosolized, okay? So when you cough, some people, when they talk, they're very animated. You may have saliva in the air. So yes, we just talked about the fact that there was a group of 60 people in a choir who practiced social distancing, and 45 of them came down with the virus. So therefore, it was aerosolized. So definitely it's in the air. And as I mentioned, it can last for 2 to 3 hours in the air. Now you guys can resend questions because the feed is going very fast. So if I don't get to your question, we'll go back, we'll send it again. This question is coming from Deb Wilson. If you test positive and are asymptomatic, what are the recommendations for retesting timeline to determine when they turn negative, or is it just 14 days quarantine? So that's asking about if you had tested positive and then became negative. So the virus, the lifetime is about 14 days. What they're currently recommending is if your symptoms are gone, and this is something that I just read today from the CDC. So if you no longer have fevers, none of the symptoms, etc., it's been about 2 weeks, 14 days, then perhaps the coronavirus is out of your system, and these people are now immune. But I don't know if there's going to be a second curve. We don't know that yet. But typically, if you have recovered from it, you no longer have the symptoms, you're 2 to 3 days outside of having symptoms, it's been about 14 days, then you should have been recovered. I would say if you're going to be working in a very highly environmental type of situation, then you may want to ask for a test just to determine that you are indeed negative. Okay, next question. Again, welcome. I see more people joining. This is Heather Lee. Is it okay to sanitize gloves while wearing them? I think that's a good question, and that alludes to what I was talking about before, which is that people can get a false sense of security wearing gloves. So if the gloves become soiled, then you're soiling everything else. I would say still make sure that you're practicing good hygiene, still be able to wipe down surfaces, even if after you take the gloves off. And in the hospital anyway, as a healthcare provider, when we wear gloves, when you take the gloves off, you're supposed to wash your hands and clean your hands. So I would say, don't assume just because you're wearing, gloves that you're totally protected. I would still, once the gloves are off, either hand sanitize or wash your hands. Here's a question from Vernex Harding. Does it help to spray Lysol in your home to keep the virus down? Okay, that's a good question. So if something's aerosolized, so this virus, okay, basically it's not alive, but it has like proteinaceous material that need to connect to something that it can survive. Okay, so if it's laying around or sitting in the air and then it connects and goes into your nose or your mouth, it's gonna start to replicate. The Lysol, is an antimicrobial. So if there are particles in the air, it will diminish those particles. And so it would be very helpful in terms of diminishing the number of particles in the air. But again, you have to still practice safe guidelines. This is a question from Ross Daniels. Is it safer due to rain? Hold on. What can we, oh yeah. Is it safer due to rain? Oh no, it's not safer due to rain. Actually, you can go to the World Health Organization. There were a number of posts there today that talked about weather. The virus is not affected by rain or cold weather or hot weather. It's not going to diminish the virus or kill the virus. So weather itself does not make a difference. And so if it's raining, it's not going to make a difference with the virus. It's just the seasons or the time or the climate that the virus is around and their particular season. So yes, there is a correlation with a lot of virulent infections that happen around the fall. So yes, there is, a prediction that there may be a second strain or a second, infectation coming in the fall. It may have a slightly different, version, such like the flu. We don't know, but vaccines are being developed. Hopefully, vaccines will be available by that time. But it really correlates more with the seasons versus a particular, weather situation, whether hot or cold. Here's a question from Andrea Webster. Should a person with an existing respiratory condition wear a mask when out in public? So yeah, we talked about that earlier. If you are susceptible and you're going to be in the public, then yeah, you should protect yourself. Miss Cassell Harris, what if you have symptoms but have never been tested? How do you know when to go out again? Just thinking, if you didn't have it, now you can really get it if you're not careful. That is correct. There is a fair number of people who have been affected. They say the numbers are up to about 50% who may not even know that they have the virus, right? So yes, you're correct. There are probably people who have had it who don't know that they have it. And so how do you know when it's safe to go out? So as of right now, there's a lot of virus being transmitted from one person to the other. It's still unsafe until such time as the CDC, World Health Organization, and public officials in the United States say that it's safe and no longer out there. I would say then you have to assume that it's out there. But in terms of an individual person who may want to go back to work, if you've not been tested, but you think you have the symptoms, again, you're self-quarantining for 14 days. If you still have symptoms, when you have symptoms is when you shed the virus, okay? If you don't have symptoms, you're a asymptomatic carrier. But if you're not, putting the particles into the air, then you're not necessarily putting it out there. It has to be transmitted one way or the other. I would say if you are out and you have symptoms, you have not been tested, and it's time for you to go back to work, you can reach out to your, your employer to say, well, you know what, it's time for me to come back. May I have a test? And now a lot of, there's a gradation of who gets tests. Unfortunately, not everybody's getting a test, and it may get there. But if someone has to go back out to work, these are the facts that I know as far as who are very easily getting tests. Those who have underlying conditions, those who are healthcare providers on the front lines, some of those who are on the front lines in a high work area, but definitely those who have fevers and symptoms, they are being tested. If you are completely asymptomatic, as of earlier today, they were not providing tests to those people because right now there are not enough tests for every single person, unfortunately, in the United States to be tested. Okay. A question about why is it so prevalent in New York? Well, first of all, New York is heavily populated, so that's one. And number two, there are a lot more tests being done in New York City earlier on. But because of the heavy population, people, congregating and being around, a lot of these areas like Times Square, the subway system, the bus system, there's a lot of congregation and a very high density population. And because people weren't necessarily at that time practicing 6 feet apart, so of course, more people got it. There's a lot more people, it's more dense, and of course there's more testing. But I think that, other states are gonna lag behind. Of course, they're not as densely populated, but we have not seen the peak yet. So, it's projected that the peak will go up before it goes down. Another question, can you get it from pets? And again, this is on the World Health Organization and CDC websites. No, at this point, they have not seen coronavirus in pets like dogs or cats or anything like that. And so they're not transmitting it to people, and people are not transmitting it to them. This question may be alluding to the fact that this virus was thought to be derived from bats, and there's still research being done on that. There may be some truth to that, but I don't really want to comment on that right now. But as far as pets, you don't have to worry about, getting it from pets. Okay, what else? If someone is around chickenpox for years in nursery and even their own kids and never had it, would you say that this person is a carrier? So can they be a carrier for coronavirus? Okay, so we're about to end the call. So this will be the last question. So the coronavirus is just a virus because of the shape and because of the spikes on it that look like a crown. That's why it's called coronavirus, but it's different from the other viruses like the retroviruses or the influenza virus. It's a different virus. So this coronavirus, it's actually the virus that caused SARS and MERS, and it's a particular type of virus that has this crown on it. So if you are immune to a retrovirus or some other virus, you're not conveying any kind of protection against the coronavirus. It's a separate virus and it does separate things. So anyway, I'm glad we were able to share this short period of time. The organizer wanted us to just do half an hour. Maybe we'll have another opportunity to do this again if you guys like this. And so I leave that up to Ms. Rosalind Daniels, who's the CEO of Black Health Matters. I really want to thank her for her vision, for hosting this coronavirus discussion. And for more information, they will post a newsletter with a toolkit for living in the age of COVID-19. And you can sign up for their weekly newsletter, which they will post as well. And if you love this, maybe we'll do this again. And maybe Rosalind will bring on another healthcare provider. But all of you, God bless, stay safe, take care of yourself and your loved ones, and long live. May we get through this pandemic and live to see another day. Thank you very, very much, and have a great day. Bye-bye.